so arterial supply. So we're looking at the posterior aspect of the body. So left, and right side. Zooming in on the heart, it's just a better view from the back side, but this is right side, left side is over here. We can see that the aorta, which is red, becomes the ascending aorta as soon as it comes out of the heart, then it becomes the aortic arch. The aortic arch is where we have our three branches: brachiocephalic trunk artery, which has two branches, and then left common carotid, and then left subclavian vein. So here with the brachiocephalic trunk artery, we have the right common carotid, and then the right subclavian vein. We can also see that off of the subclavians on either side, we have the vertebral arteries. Those come up and supply the basilar artery. And we can tell that this is the basilar artery because we see all these pontine arteries, these short little tiny arteries. And that's the cerebral arterial circle, which I'll get to. All right, so following the subclavian artery down to the arm, let me follow the left subclavian artery down to the arm. We supply some branches to the shoulder, and then at the level of the axilla, we change names and become the axillary artery. Then about mid-arm, we would tag brachial artery. Brachial artery descends down and splits into two, one to supply the lateral aspect and one to supply the medial aspect of the antebrachium. Lateral side is going to be the radial side or thumb side, so this is radial artery, and then medial side is going to be ulnar side, so ulnar artery. Traveling back up to the cerebral arterial circle, so vertebral artery is up here, basilar artery. The basilar artery is going to meet up with the internal carotids, which are right here. So internal carotids meet up with the basilar artery, and then we have an anterior portion going to the frontal lobe, a middle portion going to the temporal lobe, and posterior portions that are going to the occipital and parts of the parietal lobe. The external carotid is going to supply blood to the face, so all of this branching supplies blood to the face and the scalp. All right, back to the aorta. So the aortic arch then continues as descending aorta all the way down, but we have two separate names for the descending aorta. We have the thoracic portion of the descending aorta, which ends at the level of the respiratory diaphragm, which would be just above the liver. And then everything below that will be the abdominal branch of the descending aorta. Okay, so I'm going to spin it around. Okay, so now we're looking anterior. Now this is right, this is left. So we have the liver here, some kidneys, and the spleen. Heart up above. 8 is supposed to be our respiratory diaphragm. So the first branch off of the abdominal aorta is going to be your celiac trunk artery, which is right here. Celiac trunk artery has 3 branches. First coming off to the left side will be our splenic branch, and I can follow that all the way to the spleen. Next will be our left gastric artery, which comes into this loop right here, labeled as 85 in here. And then just next to that, we'll have common hepatic artery, and common hepatic artery jots left and then splits into 2 branches, right and left, into proper hepatic artery. Okay. Immediately after cephalic trunk artery, then we have superior mesenteric artery, and the mesenteric arteries are pretty thick. So here's superior and here's inferior, and those are going to supply blood to the intestines. In between those two, you should also see the gonadal arteries. So if it's male testicular artery, if it's female ovarian artery, and you can also find those because there are lumbar arteries back here. We should also identify the renal artery, which is on both sides and supplying one and the left kidney, respectively. All right, then we follow abdominal aorta artery, and we become common iliac artery as soon as we split into 2. Common iliac artery again splits into 2 into internal, internal iliac artery and external iliac artery. External iliac artery descends, and at the level of the inguinal line, changes names into femoral artery. Femoral artery has a big, thick branch called deep femoral artery that takes care of the posterior thigh. Femoral artery descends, and we can see that this is the knee because we have a bunch of collateral arteries. These all make a giant anastomoses so that we can bend the knee and not have any problems. Then we go into the lower leg, or then femoral artery changes names into popliteal artery, and I can tell that because of these collateral branches. Popliteal descends and branches into two, posterior tibial and anterior tibial. Anterior tibial continues down and branches into dorsal pedis artery, which is what we can actually palpate for. Posterior tibial has two branches, one laterally, which is fibular artery, also known as perennial artery, and one medially, which is the continuation of posterior tibial. Last but not least, I'm traveling back up to the heart. All of these branches are going to be intercostal arteries. And I believe that is all that you should know for the arteries.